How do you prove the value of something designed to prevent problems that never happen? Welcome back to part 2 of our deep dive into compliance ROI with Ronan. In this episode, Ross reveals his 3Ps framework that transforms how healthcare leaders measure compliance value: profit protection, preferred partner status, and patient trust equity. You'll discover how to build compliance on any budget when it's time to scale your investment, and why some organizations run lean programs while others need larger teams. Ross also shares the board training strategy that turns skeptical board members into compliance champions. Keep listening as this episode gives you the framework to size your compliance investment appropriately for sustainable growth.
Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building the sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today.
How should healthcare CEOs actually think about ROI when it comes to compliance investment?
We've talked about it quite a bit over the last few questions. How do you think about an ROI from a compliance program perspective? The way that we think about it, and after 20 years of kind of doing compliance work and what does it really mean? And I spent a lot of time in my career sitting down and talking about what does an ROI on compliance mean? How do you prove a negative? How do you prove something didn't happen because you did something? Right? It's like saying I'm driving down the street and because I'm such a great driver, I didn't get in a car accident. Is that because you're a good driver, or is that because just nothing happened to you? Is it what really happened? That's a really hard thing to prove on an ROI. And a lot of compliance people see it like that, and so do CEOs. We look at it as, and like I said, I spent a lot of time kind of thinking about this. We call it the 3Ps. The 3Ps are very important for us. The first one is profit protection. And when you talk about profit protection, the money that you lawfully made should be kept in your coffers. And the only way to do that is to ensure that you're doing it the right way up front, so that you're not giving your money back. You're not having these TPEs and UPIC audits or investigations that are happening that are costing you to refund dollars because you just didn't do your auditing and monitoring up front. And that really can help prevent any refunds or recoupments by the federal government. You keep that money that you actually can do. And that's a bottom line revenue hit or EBITDA hit when it comes to giving money back. So really protecting those profits that you have lawfully made. And if you're doing it wrong, okay, give it back. Let's fix it so that it's not a huge 7-year problem. It's a 6-month problem or it's a 6-week problem. That's what a good compliance program can help you do on an ROI. Keep that money that you have and actually go forward as opposed to giving it back. The next one is preferred partner status. The preferred partner status, in my mind, is one of the biggest pieces that people overlook. We talked about it a little bit to say reputational harm, reputational costs that it might affect. The same thing is with preferred partner status. Nobody wants to do business with someone who's considered a bad actor or someone who's gotten in trouble. They just don't, because that smear goes on them too, because they're like, oh, you're partnering with someone who paid $10 million in False Claims Act violations. They don't want to be a part of that. They want to be part of the good guys. They want to be part of the people who are doing things the right way. So that being that preferred partner status can be provider groups who want to deal with hospitals who want to have transfer agreements with other hospitals, payers who want to work with different providers or different hospital systems to say, yeah, we want to be part of your good network because you're not getting in trouble. Patients are getting good quality care. And at the end of the day, we see that if we build a partnership with you, we can change healthcare and we can make it a great place. So that preferred partner status is really important. And I've been on lots of calls where my CEOs have come to me and say, hey, I need you to talk to this client that we're trying to get a contract with or we're trying to partner with, because they said, do you have a compliance program? Tell me about it. What does it mean? And doing that, we get on the phone, we explain that we're not a roadblock, we're a strategic partner. And 9 times out of 10, that's one of the selling points that they have. In addition, if you're talking about being a provider group or a healthcare entity at some point in time and you really want to be acquired either by a strategic partner or an investment partner, that is reputational risk too. They want to know that you have a good reputation where they're investing their money and they're investing their time, effort, and reputation in that company. So that's preferred partner status. And then finally is patient trust equity. That to me is the pinnacle, the top. Our main job in healthcare is to provide great quality care so that patients can thrive and not have huge healthcare costs and really trust the providers who are providing them healthcare. Once patients start trusting those providers, whether it's a hospital system, it's a lab, it's an ambulance company, it's a physician group, once they start trusting them to say, you're not going to order tests on me that I don't need just for money. You're not going to upcode this claim because I have a high deductible plan and you're going to do a 99215 versus a 99212 or something else and charge me more money. Once you start creating that trust with the patients, they'll start coming back to you. You start gaining fans, you start gaining friends, you start gaining people who go, I trust this provider and I always will. And if we can have patient trust as providers, as insurance companies, then healthcare will be tremendous, healthcare costs will be lower, and patients will really see it as a benefit.
So the ROI is clear, but what about the startup or small organization that genuinely has tight cash flow? How do you build compliance on a budget?
There's a number of ways to do this, and the OIG does come through and they talk about what happens if you're a small company versus a large company in healthcare. And you really can scale your compliance program to meet your needs based upon the risk factors that we talked about earlier, how much revenue, how much you're willing to put at risk, and then 2, how many compliance issues do you really have that are taxing your organization. One thing that I would say is a lot of people say, we're really compliant because we don't have any compliance issues. And I say, okay, well, do you have a disclosure program? Are you asking people? No. Are you doing auditing and monitoring or picking up rocks? No. How do you know you don't have compliance issues if you're not looking? And what I mean by looking is I'm looking underneath stuff to find out whether or not there's problems, right? So when you think about that, you're like, okay, well, you may or may not have compliance issues, but what you need to have are the 7 elements of a compliance program, and that's really important. And when we talk about those elements, they are the essentials. You got to have them, and what varying degrees that you may have them is really dependent on the size of your organization. I always go through kind of the laundry list of those elements. The OIG puts them in one order, I put them in another, but you got to have leadership. Now, you got to have leadership, and leadership with the organization becomes a compliance officer or somebody to be responsible for the compliance program. That person should be independent from other functionalities, as the OIG indicates. They don't like people who can ever develop a conflict of interest in a situation that they have a compliance matter that they will have to choose one way versus another. And when you talk about general counsels, they have different obligations, different fiduciary responsibilities to the organization than a compliance officer does. You talk about the COO, you talk about the CFO, you talk about anybody in operations. Their job is to make money, put those pieces in place so that they can operate and generate revenue. Same thing with the CFO. I want to protect the money that's there. I want to be able to pay my bills. Those 3, the OIG calls them out. You can absolutely create a conflict of interest in any one of those 3 when you have a compliance officer do the dual role or reporting to that individual. So when you talk about small companies versus medium-sized companies versus large companies and putting in the leadership, you can tag someone to be the compliance officer and leader. Just make sure that they have the independence that they need. Secondly, on that leadership side of the essentials is your executive compliance committee. And a lot of people overlook that because they're like, hey, I hired a compliance officer, or Sam over here is our compliance officer and they're going to handle it. They do compliance. I don't need to deal with it as CEO, CFO, COO. I don't need to do all those things. The answer to that is no. The OIG wants to see the executive team be part of the compliance program, in part because everybody should know what's going on with the organization. One, two, everybody has a dog in this hunt. Everybody should be accountable for the compliance program. Even if you're having someone oversee it, run it, the executive compliance committee is on the hook. So those two pieces under the leadership essentials pillar or element is really important to be able to establish first and foremost. Secondly, a disclosure program. Disclosure program, in my opinion, is the window to the world, the window to the world of your company. What do the employees know? What do the patients know? What do the providers know? Who knows what is going on? Because whether you know it or not as a CEO or board member or CFO, somebody else out there has heard a rumor or has seen something happening that you want to know about as a company. That disclosure program, that hotline, that web intake portal, the email address that you create for compliance that is anonymous so that people don't see, they can make calls or they can make reports and not fear of retaliation. That is essential to understand what's going on with the organization. That coincides with auditing and monitoring, which is one of the third elements of the compliance program. Picking up rocks. I need to audit and monitor. I need to understand what's going on with my coding, billing, and a kickback statute contracts. I need to see what's happening with our sanctions checking and monitoring those individuals. This is where you know what you don't know. The disclosure program are people telling you. The auditing and monitoring are you finding those things out. And then wrapping up another 7 elements, but wrapping all of that up, fifth one is policies and procedures. Really having those policies and procedures in place. And I'm putting these in order of importance so that people, employees, contractors, and vendors know what they can and can't do within an organization. As an organization, you have to protect yourself. Part of that protection is letting people know what those standards are. What's the code of conduct? What can I do and what can I not do? If you've never told them, they can always come back and go, well, you never told me. And you go, well, you're right. You should know. Well, okay, great. How many times have you sat around and you go, you should know better? Okay, well, that's not okay in a company, especially in a healthcare company. That's why we have policies and procedures. You will know because this is your SOP, this is your policy and procedure. And so to be able to enforce those are really important to be able to do that. And then we have corrective actions and investigation protocols. But one of the last most important things is training and education, because you have to be able to train people on what is a compliance program and what are policies and procedures, how do you do them? And then you have them acknowledge that they are going to comply with them. And that's really how you hold them accountable. So as a small organization, right, there are ways that you can put all of those elements in place without breaking the bank. You can have a leader who is maybe HR, who's also HR, who's maybe IT, or maybe who is risk management, right? You can do the dual role. You can not necessarily have an outsourced compliance disclosure program with a Ethico or a Navex or something like that. You can do a 1-800 number. Okay, that's good. Is it the best? No, but it is doing something. And then you do your audits, right? And those will cost you money, but you really have to put those elements in place to ensure that you have an effective compliance program to protect you and your company.
When should an organization level up their compliance investment?
On the average, HCCA produces a salary survey, a compliance program, and talks a little bit about what it costs for a compliance program. I think that's important as a benchmark to hear. Not everybody participates in that salary survey, but it's a good kind of check to find out where somebody should be as an entity based upon revenue, based upon size, based upon employees. I find it very difficult to determine, based upon size, how big your compliance program should be or how much it should cost. I've seen compliance programs function at the best efficiencies that it could possibly do. They have processes in place. They don't throw people at problems. They throw processes at problems. Everybody knows what their SOP is. They're able to answer questions pretty quickly. They have the tools to be able to do it on a very kind of small human resource expense standpoint. And then I've seen multi-billion-dollar companies do compliance program with 20 people. I've seen multi-billion-dollar companies do it with 150 people. And so is that because they have efficiency problems? Is that because they're throwing people at problems? Not quite sure. I have to get in and figure it out. But when you establish a compliance program, and it should run you anywhere from $150 to $250,000 as a small company, $250,000 to $500,000 as a medium-sized company, and probably over $500,000 when it comes to larger companies. And that 90% of what you're dealing with in a cost standpoint from a compliance program is salary and labor. Right? That's going to be your number one cost. Your second cost is going to be your auditing and monitoring program, because you should outsource that to experts in the industry. Compliance is not necessarily always the coding experts. There are a lot of experts out there in the industry to be able to do that. And the third, probably most expensive cost, is your disclosure program. And those three things should be anywhere between $150,000 to $200,000 as a small entity, as a small business. When you think about that, is when do I scale? When do I go from a part-time compliance officer to a compliance officer who's fractional, or even an outsourced compliance officer like we are? When do I go from that to being somebody that's internal, that may run us from $150,000 all up to $250,000? And that is really based upon the risks that you're seeing as an organization. If you have a lot of government payers, like we talked about earlier, if 90% of your business comes from the government payers, invest in a compliance program. Invest in them, invest in a compliance officer. You're going to need that because you're at risk. Your risks are really high. If you're at 3, 4, 5, 10% government payers, your risk is really low. Maybe you have someone who's really fractional and part-time, or a quarter of their time does compliance on that $1 million that you have out there. It depends on what you're dealing with. So that's what your risks are. When your risks get higher, when your payer matrix, your payer mix goes up on a government standpoint, those means your risks get higher. 2, compliance issues. How many compliance matters are coming in? How many complaints do you have? Who is handling those complaints? Once you have this volume of complaints that just says, we need a full-time compliance regulatory specialist, or a compliance specialist, or director of compliance to help manage all of these things that need to be tracked, trended, and investigated, then you look at, how am I going to increase my spend on compliance? But it doesn't always have to start out that way. You can always start out with putting the elements in place and start seeing what's out there, and then build your compliance program. One thing that I will say is your cost for your compliance program should not necessarily need to scale with the amount of revenue or size that you get. And I see this a lot from our current clients, where they'll say, we're a big company, we need bigger than a fractional compliance program. And I say, yeah, potentially, absolutely, and I totally agree with you. But let's just see. If a compliance program is put into place, and I do know a lot of compliance officers out there, or compliance leads, who feel that the more employees that they have in the compliance program, the more that they do, the more that they are important, if you will. Also, scope creep on compliance happens a lot, where compliance wants to handle risk management or anything else that needs to be handled by somebody else. But if you're truly doing compliance, and you truly put the right processes in place, and you can streamline and be effective, your compliance program can scale with the growth of the business without having a material change on your budget. Maybe $50,000 add because you went up $2, $3 million, $5 million in revenue. Okay, great. That's not a bad thing. Add another person, right? But ultimately, if your compliance program is set up the right way, regardless of your size, and it's set up with processes, people, and not throwing people at problems and throwing SOPs and processes at them, that company can scale, or that program can scale with no matter how many acquisitions you do, with how much growth you do, organic growth, you should be able to absorb that until your risks become too high or your volume of compliance matters continue to go up. Third-party audits, UPIC audits, TPEs, whatever it may be, then you might need to bring in additional resources to handle them.
For CEOs who need to make this case to their board or investors, what's your advice?
Well, hopefully it's the other way around. Hopefully it's the boards telling the CEOs that they need a compliance program and not CEOs telling boards. But I do see that happen a lot. When I see that, or I have a conversation with the CEO to say, help me sell this to my board, the first thing that I do is say, let's do some board training. And board compliance training is different than, let's just say, your company compliance training, your executive leader training, or your employee training when it comes to compliance based upon compliance department or relevant laws or HIPAA or whatever it may be that you're out there talking about policies and procedures or code of conduct. When you talk about board training, you're talking about having somebody who's an expert in compliance come and sit down on the board and say, look, you have a fiduciary duty of care to this organization, and that fiduciary duty requires you to ask questions of the organization about the compliance program and about compliance with all these healthcare laws. OIG says it, the DOJ says it. They want everybody at the board level to be actively involved because they can be held accountable for any violations of law as a board level, as an oversight piece of it. And we see this a lot. We see a lot of private equity groups who join boards, or we just say independent board members, who are held accountable because they knew that there was fraud, waste, and abuse going on, or they knew there was False Claims Act violations, or they knew that there was an kickback issue that was going on, or they did nothing about it, or they failed to ask the appropriate questions. There were red flags. They failed to dig in. Caremark case is a huge one when it comes to board liability when on boards, and there's a number of different cases thereafter that we educate boards on. And I think it's really important for them to understand their own liability as a board member, their own personal liability, and their fiduciary duty to the organization to ask the right questions. So that's a long-winded answer to say, as a CEO, if you need to sell a compliance program to a board, get them educated on it. Have somebody come in, whether it's an outside counsel, whether it's a consulting company like ours, have somebody come in, spend a half an hour, sit down with boards, talk to them about their duties. We do board training for free because we feel like it's so important to be able to educate the board members. Now, a lot of board members that we deal with, they come to us first and say, we need a compliance program, and we told everybody we're going to do it. So we love those board members too, and we have a lot of them on our podcast. But really have them trained in what that exposure is. Once the CEO knows it, then there shouldn't be a lot of selling. And if the board pushes back, get them trained.
That's really good advice. We hope you enjoyed part 2 of our series on compliance ROI. You've heard how the 3 Ps framework transforms compliance measurement and how to build programs that scale with your growth. Now, stick around for part 3, where Ross brings it all together with the practical steps healthcare leaders can take right now to activate compliance as a true strategic partner. You'll discover how to position your program for maximum impact and turn compliance into the competitive advantage that drives sustainable growth. Don't miss the final part of the series.
Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.